Okay, so my name is Swetha Manne. I'm a third-year medical student at UTMB John Seeley School of Medicine, and this is my co-author.
Hi, I'm Yasamin Rastgar. I'm also a third-year medical student at John Seeley.
So our project is titled X-ray Vision: What Medical Students Know About Radiation Safety and How That Impacts their specialty choice for residencies.
Yeah, so just a little bit of background information and some introduction to the topic. We found that women have been a minority in many surgical fields, but the number of female surgeons and interest in surgery has been increasing. In fact, women make up 36.3% of practicing physicians, 38% of resident physicians, yet only 20% of general surgeons are women. The reasons women remain a minority are multifactorial, but a lot of it has to do with lifestyle concerns of family planning and pregnancy during training. Female residents are shown to have higher rates of perinatal complications like birth complications. For example, 13% of complications in residents to 1.7% in the general population. Increased rates of infertility, 30% in residents, 11% in the general population, and increased pregnancy losses. And many surgical and interventional subspecialties, the use of intraoperative radiation is becoming more common, and resident and medical student education on radiation is becoming more important. Radiation can be feared because of its teratogenic effects and could be a reason pregnant females or those who want to become pregnant in residency could stray away from surgery. Literature also shows that medical students don't feel confident about radiation safety and are rarely taught courses involving this in their education, and women account for just over half of all medical students. So for our objective and aims, we're hoping to bring awareness to these potential setbacks or situations that discourage women from pursuing these specialties, explore the impact of intraoperative imaging advances on surgical training deterrence, and also kind of figure out what fourth-year medical students know on radiation risk and radiation exposure in general. We have a chart here in the middle that compares male and female residents and shows what the difference is in their surgical training. So there was no difference in their intention to pursue surgery or their interest in surgery. There was no difference in caseloads, exam pass rates, or attrition rates. However, there was a difference in deterrence secondary to family planning concerns. We found that female surgical residents had fewer children during their surgical residency compared to their male counterparts, at a rate of 28% for females compared to 54% for males on the high end. They also had their first child later in life and had fewer children overall compared to the general population. They had increased infertility rates, like we talked about, increased pregnancy complications, and more negative attitude towards pregnant residents.
Yeah, so this is currently a work in progress project. So kind of the future directions we're looking at once we are able to get IRB approval and get the survey distributed this will be a survey study that'll be carried out at UTMB. Particularly targeted currently towards fourth-year medical students who are currently looking at applying to residencies. The surveys will be distributed by admin and modeled based off of previous data that kind of address these barriers to enter surgical residency or for applications for surgical residency, and kind of try and address these factors. Along with demographic information like ethnicity, gender. Some examples of survey questions that we want to include are: do you feel that pursuing surgical training would prevent or delay you in having children? A few yes or no questions like: is there a link between ionizing radiation and future development of cancer? Radiation dose from abdominal CT scans is equivalent to 100 chest x-rays. Some other questions are like whether students are aware of safe radiation doses. Do you know when the fetus is most sensitive to radiation? How strongly are you considering having children during the training years? For a lot of us entering med school, those kind of residency years tend to be our peak fertility years, which is why a lot of women tend to struggle getting pregnant if they wait to have children until after residency. So these are all kind of things we want to assess, and trying to figure out whether this is actually a deterrent factor or not, and kind of also gauge whether students have been thinking about radiation safety and if they've even considered this as as whether it's something on their radar and if they've considered it to be a deterrent factor or not. And maybe that's because they were unaware that it's even such a large issue, especially in some of these fields like IR or vascular surgery, where angiograms are quite common, and those use some very high radiation density scans. The chart at the bottom kind of addresses a few compounding reasons for why people might not pursue a certain residency program. So family planning, like we talked about, has been one of the better studied components that deter people from entering surgical or interventional residency, and intraoperative radiation is kind of this new factor that's become more common. So to see if that actually has increased deterrence or not is what we're aiming for. And then for application, this research could improve radiation safety for medical students in their clerkships and throughout their future careers. Medical schools can better incorporate radiation safety educational sessions in their curriculum and use the opportunity to kind of build interprofessional relationships with radiology technicians. Due to sparse existing literature on the impact of radiation exposure and teratogens on pregnant trainees, there's little education or maybe some awareness on the matter. And then we hope that better policies and guidelines can also be developed to protect pregnant surgical trainees without compromising their training and education, and also to help prevent fueling misconceptions that potentially could amplify risks for pregnant trainees. And then we have some takeaway questions at the bottom.